Welcome to Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health, where we bring evidence, experience, and perspective to make sense of today's leading health challenges. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
This is Lindsay Smith Rogers. More than a decade after electronic cigarettes became broadly available in the U.S., their merits are still being debated. Do these products help people quit smoking? Do they carry serious risks that should not be overlooked? This week, we hear from two tobacco control experts in a two-part series. In part two today, Professor Stan Glantz, the Truth Initiative Distinguished Professor of Tobacco Control at the University of California, San Francisco, and the lead author of a recent paper in the New England Journal of Medicine Evidence, talks with Dr. Josh Sharfstein. In an epilogue, we'll also hear a personal story from a dual user who describes his smoking cessation journey. Let's listen.
Professor Stan Glantz, thank you so much for joining me to talk about the health risks associated with electronic cigarettes. And let me ask why you decided to do this study.
Well, e-cigarettes are widely assumed to be safer than cigarettes. And the reason for that is the way a cigarette works is you set the tobacco on fire, and that generates an aerosol of nicotine that you inhale, and it takes the nicotine to your lungs and then to your brain. In the process of generating the aerosol by burning the tobacco, you generate a lot of toxic combustion products. An e-cigarette also delivers an aerosol of nicotine by inhalation, but it generates the aerosol by heating up a solution of nicotine and other chemicals, and so you don't get the combustion products. And the result of that is that a lot of people, including the U.S. Food and Drug Administration, assume that e-cigarettes are a lot safer than cigarettes because you don't have the combustion. Nobody up until we did our study, however, has done a head-to-head comparison of the actual disease risks of e-cigarettes compared to the disease risk of cigarettes. They've just simply relied on the fact that e-cigarettes don't deliver combustion products. And what we found was that for a lot of disease endpoints, including cardiovascular disease, stroke, and metabolic dysfunction, e-cigarettes pose disease risks which are indistinguishable from cigarettes. For other endpoints like asthma and COPD and oral disease, they're a little bit less risky than cigarettes, but the difference in risk between e-cigarettes and cigarettes is nowhere near as big as everyone's assumed. And the final thing we found was dual use, which is when people smoke cigarettes and use e-cigarettes at the same time, which is a very common behavior. That's actually worse than just smoking.
So I want to dig into these findings. Thank you for that great overview. Can you explain how you went about answering this question, comparing the health risks of electronic cigarettes with cigarettes?
Well, the first thing we did is we went out and systematically searched the world medical literature for studies about the relationship between e-cigarette use and disease in people out in the real world as e-cigarettes are actually used. And we screened several thousand papers. We found 107 high-quality population-level studies that looked at the association between e-cigarette use and actual disease outcomes in the population that also took into account any smoking that those people did. We then went through all these 107 studies and found disease outcomes where there were at least 5 studies of a given disease outcome. And we found at least 5 studies for cardiovascular disease, stroke, metabolic dysfunction, asthma, COPD, and oral diseases. We then extracted the risks that were reported in these studies and then pooled them or essentially averaged them for each outcome using a statistical procedure called meta-analysis. And what a meta-analysis is, it's essentially averaging the results of the different studies, controlling for how big each one of them is.
Let me make sure I understand the order of your study correctly. Would it be fair to say that you identified the quality studies before you looked at the results of those studies? Or did you know what the results of the studies were before you picked the ones to include in your analysis?
We identified the studies based on the fact that they were studying e-cigarettes and disease. We did not look at the results in the studies until we had identified them. That's actually a very important point, because one way you can bias efforts like this is to pick the studies you're going to average based on what the studies show, and that would be cheating.
Got it. So you looked at the evidence, and it was not maybe what most people would have expected.
There were two things that we found that surprised us and a lot of other people. The first thing was when I've gone out and asked my colleagues, how many studies do you think there are of the association between e-cigarette use and actual disease outcomes? Most people would say 5 or 10. Most people think there isn't much information out there on this point. And as I said, we found 107 studies. And the other thing that basically everybody, including me, thought for a long time was because the e-cigarettes don't deliver combustion products, they're going to be safer than cigarettes. When we went into this, we didn't have an a priori assumption of what we were going to find in terms of how risky e-cigarettes were compared to cigarettes. That was something that emerged from the analysis.
Now, your assumption or people's assumption that not having combustion products in e-cigarettes would make them safer didn't pan out for the outcomes that you studied for the most part. Why is that, do you think? What could be explaining it if you have all these extra toxins in cigarettes compared to e-cigarettes? What could explain the findings?
There are two things that explain it. The first thing is that e-cigarettes are different from cigarettes. I think if you go back, years ago, the assumption was that an e-cigarette was kind of like a cigarette without the combustion products. So it was a cigarette without quite as much bad stuff. I mean, I thought that. I think everybody did. But what we now know is that the toxic load that e-cigarettes deliver is different than a cigarette. Like, for example, the liquid that's used to dissolve the nicotine in e-cigarettes is a mixture of propylene glycol and vegetable glycerin. And while those chemicals are used a little bit in cigarettes to keep them moist, you get a much, much higher dose of propylene glycol and vegetable glycerin from an e-cigarette than you do a cigarette. E-cigarettes expose people to a lot of heavy metals because of the heating coil that aren't necessarily in cigarettes. And so what you're doing is, it's true that you're not getting, for the most part, the combustion products that a cigarette produces, but you're getting a bunch of different chemicals, which also have toxic effects. The flavoring agents used in e-cigarettes, a lot of those are quite toxic. For example, cocoa oil. If you eat it, it tastes like chocolate. It's yummy. There's nothing wrong with it. If you aerosolize it and inhale it, it tears up your lungs. So it's a different toxic exposure. The second reason is that a lot of the toxic effects that you get from inhaling things are nonlinear, especially for cardiovascular disease.
Could you explain nonlinear?
You get a linear effect when the effect is proportional to the dose or the stimulus. So if you double the amount of whatever it is you're taking in, you double the effect. For example, exposure to ultrafine particles, which both cigarettes and e-cigarettes expose people to, the effect of low levels of exposure are quite large. And so what happens, the initial exposure, even though the level is pretty low, has a big increase in risk. And then as you increase the exposure, the risk tends to go up, but the rate at which it goes up slows down. You can see this if you look at secondhand smoke and heart disease, for example. The exposures that a secondhand smoker gets to cigarette smoke is maybe 5% of what a smoker gets, but the disease risk is about a third or a half. So you have systems which are exquisitely sensitive to low levels of some of these toxins. And so the fact that the e-cigarette is exposing people to less of some things may not make that much difference because any exposure is creating a problem.
Interesting. It's a fallacy to think, in other words, if I'm only getting 1% of a toxin, I'm only facing 1% of the harm from that toxin.
That's right. If you compare the heart attack and stroke risk in a pack-a-day smoker to somebody who's smoking one cigarette a day, the person smoking one cigarette a day has something like a third or a half the risk of a pack-a-day smoker. So some biological systems are just exquisitely sensitive to low levels of toxic exposure. And if you add more toxins, then you usually increase the effect, but it's not proportional.
I want to zero in on one of your other findings, which has to do with dual use, which I understand means people are smoking both cigarettes and using e-cigarettes at the same time. And this is relatively common. You have people who, reach for one or the other. They have a pattern of what they're going to do. Could you walk through what you found about that?
What we found for dual use was for all of the outcomes that we quantified: cardiovascular disease, stroke, metabolic dysfunction, asthma, COPD, and oral disease, dual use was worse than just smoking. The risks, depending on the outcome, were 20 to 40% higher.
That's pretty impressive and a little counterintuitive because you might think if you're getting less cigarettes, then maybe overall it would be less, but you found worse effects.
Yes, and there's a couple of reasons for that. First of all, a lot of people who are dual users don't cut down on their smoking or don't cut down very much. So they're still getting the insult from the cigarette smoking, and then they're adding on the different insult from the e-cigarette. The assumption that a lot of people made, and that the FDA continues to make, is that, well, if someone's a dual user, they're going to smoke less. And while the evidence on cigarette consumption in dual users is pretty variable from study to study, overall, there doesn't seem to be much change.
So the first reason why dual use may be worse for you is that you might keep smoking pretty much just as many cigarettes as before. What's the second reason?
The second reason is that when you're a dual user, you're exposing yourself to all the toxic chemicals in the cigarette, plus all the toxic chemicals in the e-cigarette, many of which are different.
So let me ask you about one thing you didn't study, which is the risk of cancer. And I know there's special concern about combustion products and cancer. Do you think the results might be different for cancer?
Well, we actually did study cancer. The search that we did was very broad and, in fact, included cancer. But to date, we only found one qualifying cancer study. And our rule for doing a quantitative meta-analysis, that is coming up with an overall risk estimate, was we had to have 5 studies. So while the paper focuses on the 5 or on the areas that I listed before, we also turned up 1, 2, or 3 studies in a whole range of other disease areas, including cancer. But before we can do a quantitative risk assessment of cancer, we're going to have to wait till there's more studies available. The other difficulty with cancer is, unlike cardiovascular disease or asthma or oral effects, for example, where the effects of the e-cigarette or smoking occur almost immediately, it takes a long time for cancers to develop to the point where you can detect them. So I think it's going to be a while before there's a lot of good cancer data out there. We do know, though, there are animal studies that show that you can induce lung cancer and bladder hyperplasia in mice by having them breathe e-cigarette aerosol for about a year. And there are also genetic studies in people showing genetic alterations associated with e-cigarette use that are cancer related. So while we can't come up with a number for cancer, I think there's no question that, e-cigarettes are increasing cancer risk. Now, whether they're increasing them comparably to cigarettes, like we found for, say, cardiovascular disease, or whether they're increasing them less than cigarettes, we'll just have to wait and see.
For those products that are marketed as e-cigarettes, do you think there needs to be more education or information available to consumers about their risks?
Oh, yeah, because a lot of people think they're harmless. People think they're harmless water vapor, and there's no water vapor in an e-cigarette. The e-liquid is propylene glycol, vegetable glycerin, nicotine, and flavoring agents. And people need to understand that these things are quite risky. And in fact, they're probably a little bit less risky than a cigarette, maybe 10 or 15% less risky. But, to jump out of the 45th story of the building instead of the 50th story, there's not much difference in the practical effect.
Well, that is certainly a vivid image. Let me ask you this. There is a conception in tobacco control of a continuum of risk where people are at the highest risk smoking cigarettes and less risk using e-cigarettes. And then a goal of public policy may be to move people along that continuum of risk. What do you think the implications of your findings are for that framework?
Well, that approach that you're describing is, in fact, being promoted by the FDA. And I think based on the fact that e-cigarettes expose people to a little bit less combustion products. But what our study shows is that that continuum of risk, if it exists at all, is very compressed. And so we should stop talking about the continuum of risk because you're just telling people switch from one product that's very dangerous to another product that might be a tiny bit less dangerous. But as a practical matter, you're not getting any substantial benefit from the switch.
Well, Stan Glantz, this has been a very interesting conversation. I appreciate your sharing the results of this paper, and I'm sure you're going to stimulate a lot of discussion.
Thank you.
Hi, listeners. This is Lindsay Smith Rogers, producer of Public Health on Call. Thanks for listening to this two-part series. Throughout the episode series, we've heard from experts who are weighing the risks of electronic cigarettes and often mentioned dual users, or people who smoke both traditional and e-cigarettes or vapes. Now, we're going to hear from a former smoker about his experience trying to quit, becoming a dual user, and what ultimately worked for him. Matt Martin is the content production supervisor in multimedia at the Bloomberg School of Public Health and one of our audio engineers on the podcast team. Let's listen to what he has to say. Matt Martin, I would say welcome to Public Health on Call, but you're an integral part of this podcast. You are one of our main audio producers. So how does it feel to be on this side of the mic?
It feels pretty cool. Yeah, I've been here pretty much since the beginning. You guys were the voice of my pandemic, for sure.
Oh, man. And now you're first time on the podcast, first time guest. Yeah. So today we're going to talk about, we've had these two episodes about electronic cigarettes and some new data that's coming out about them. You're a former smoker. And not only are you a former smoker, you're actually a former dual user, which we talk about in both episodes of this series.
Yeah.
Could you tell us a little bit about your smoking history first?
Sure. So, I started around 18, and for everybody out there, I'm about to be 39, and I quit in 2020. So I smoked for almost 20 years there. And Yeah, around 2014, it seemed to be like the craze and the big thing to get into vaping, and it seemed like the healthier option. And so I got fully into that, and for a little while was not smoking cigarettes at all unless I couldn't get what I liked as far as vape juice. And so at some point I was very much a dual user.
Can you tell us about like when you were a dual user? So you said that you maybe were looking to quit smoking cigarettes and you thought this was the healthier option, but you were using both. So how did that happen?
Well, I would say like a lot of other smokers, I had my brand that I liked, and there wasn't too many other options that I would really go for. And even if it was around, I wouldn't want it unless it was the brand I liked. And the same really applied to me for vape juice as well. And at the time, there still are a lot of just vape only stores, and they would sell those kind of products. And they weren't really into 7-Eleven. 7-Elevens had like a Juul or the other little blue cig type thing. And that was about it at the time. And those, I didn't like them. They didn't cut it for me. So for me, if I got off work late, which I did at the time, I worked for a production company, and I couldn't go to my vape store and get my juice. So my option was to go back and get cigarettes again and buy a full pack, and I didn't waste it, So yeah, and it would end up being kind of both, but it also was about convenience too, as far as where you could or couldn't do one or the other.
Sure.
And who I was around as well. Just other people who smoke cigarettes. Sometimes you just would have one with them.
Did you know other people that were also dual users?
Oh, absolutely. Yeah. Especially because I can say the environment that I was working in was a warehouse, and our boss also vaped, and he didn't care if we vaped in the warehouse. So that's another thing that really increased my intake for sure, or made it very difficult to keep track of how much I was taking in versus cigarettes. And yeah, and a lot of people were smoking cigarettes too. So it just was all happening all at the same time, all the time.
So, and you have reviewed, both of these podcasts that we've ran. Tell me a little bit about your initial reaction to, say, the episode that we just heard, which was with Stan Glantz.
That one, I really felt like I got a lot out of that one. I felt that I was really hearing hard science in that I didn't hear back in 2014. I think a lot of us thought it was healthier for us because it was just propylene glycol and vegetable glycerin, and that was in other things that we consumed, but we weren't aerosolizing those products and taking them into our lungs. And hearing that it was basically the exact same amount of risk for health issues versus smoking a cigarette, and that it was even worse if you were a dual user, was something that I definitely would have loved to have heard back in 2014.
Yeah. And then after hearing from Nancy Rigotti, obviously she talks a lot about the fact that electronic cigarettes are part of this smoking cessation toolkit. I mean, how does that hit you?
I mean, I can remember in 2014 being excited about going to the store to buy this vape because I felt like this was going to be the right choice to make to help stop smoking. And I did stop using cigarettes for a while. And that was great because I had tried other I had used the patch, I had used mints, and I was always continuing to use cigarettes with those. It was never quite hitting it on the mark, but the vape did. And then I still feel like it made my nicotine intake go way up because I wasn't restricted to only doing it outside or in my car, right? I could do it wherever I wanted all day long. Especially back then, you could almost vape anywhere you wanted, and they didn't have laws about where you could do that yet. And that's why I didn't like the idea necessarily of it being another tool in the toolbox. But at the same time, if it's going to help somebody get off of it, great. But I don't think it did that for me.
You were a smoker for almost 20 years, and now you're, congratulations, by the way, 4 years smoke-free.
Thank you.
What ultimately worked for you?
It was cold turkey. Because I'll say this. The day that I decided to quit, I know I was at home. So we were all at home for the beginning of the pandemic. And I went outside to have a cigarette because I was having a craving. And then in the middle of that cigarette, I was having a craving for a cigarette. And it was the strangest feeling of like, wait, I'm already doing this, and I'm not going to start smoking too. Like this just clearly isn't working for me anymore. And I had a moment of like, this is done. I wanted to be done with it. And I think that's the biggest thing about it. If you're going to quit it, you have to be in that right mindset or it's just not going to happen, And then I basically took a Friday off of work and then picked those 3 days, like a 3-day weekend, essentially, to just stay at home, refuse to go anywhere and just kind of get over the hump. And Because I mean, I don't know if that's scientific fact, but I'd always been told you had to get through 3 days of no nicotine for it to get it out of your system and to stop fighting the physical cravings. And after that, it would be just mental.
In your experience, did that work for you?
It definitely helped. And I hadn't done that. I had tried for a couple times to go cold turkey, and I'd make it a day and a half. And then you have all these irrational thoughts of how you could just go buy a pack of cigarettes and it's not a big problem. And yeah, I mean, it was a legitimate addiction. And getting after those 3 days, that was huge. After that, I was able to just try and work on it mentally, and being at home for all that time really helps.
Given what you know about what ultimately worked for you, you had just come to a time in your life, you had this resolve, you were like, I'm done with this. And you pushed through. The previous times that you had tried to quit, even if you had that resolve, but you had decided to use, the electronic cigarettes as a cessation tool, do you think you would have been successful?
No, because I think the nicotine, it would have just continued my addiction. As long as the nicotine was in there. I mean, that was, I think, the issue with any of the cessation tactics I had. They all still had nicotine. So, regardless of what I was going through mentally with it all, I was still feeding the physical addiction to nicotine. And I think really severing that is key.
And I know that cold turkey is not an option for everyone, but do you have any advice to people that might be considering electronic cigarettes as sort of that step down approach? Like, is there a way that you've seen people use them successfully?
Well, I can say that when you would go to an actual vape store and buy vape juice, they can sometimes customize the amount of nicotine that's in it for you. So if you're going to do it, have a plan to actually wean yourself off of that nicotine and maybe do it slowly with that. I think it can be difficult to try and do that with set amounts of nicotine that never change, and you're just trying to change how much you're doing it. Now, you could keep your physical habit, but reduce the amount of nicotine and eventually get to where you're just vaping nothing but propylene glycol and vegetable glycerin, which still doesn't sound that great to do, but at least you're getting off the nicotine.
Yeah, that doesn't have that refreshing sound to it. Well, Matt, thank you so much for sharing your perspective as a dual user. I think it's really important to hear these stories, and congratulations on being 4 years smoke-free.
Thank you. No plans on going back.
Awesome. Thanks, Matt.
Public Health on Call is a podcast from the Johns Hopkins Bloomberg School of Public Health, produced by Joshua Sharfstein, Lindsay Smith Rogers, Stephanie Desmond, and Grace Ceciri. Audio production by J.B. Arbogast, Holly Cardinale, Spencer Greer, Matthew Martin, and Philip Porter, with support from Chip Hickey. Distribution by Nick Moran. Production support from Catherine Ricardo. Social media run by Grace Ceciri and Eliza Rosen. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Thank you for listening.